Cholesterol has been blamed as a major cause of heart disease in America, but our next guest is taking a different approach to the cholesterol theory. We welcome Dr. Ernst with Cornerstone Health Center. Hello, sir. How are you doing?
I'm doing very well, thank you.
All right. Well, it says that cholesterol and heart disease goes hand in hand. So, what is behind so many people having heart disease?
Yeah. Well, this is a tricky question, and I want to make sure I'm very clear on this. For the last 60 or 70 years, we've always said cholesterol goes hand in hand with heart disease, but now we're starting to find out that that's not necessarily the case. What we know is a precursor to high cholesterol is actually more of a metabolic disorder where there's a lot of inflammation, possibly a fatty liver, maybe even a gut leak. So now we're taking a different approach by saying cholesterol doesn't always cause heart disease, but what always does is inflammation and toxicity.
So what is the correlation between heart disease and processed food?
So there's a massive correlation. You have to understand, if we go back 50 or 60 years ago, there was not a lot of heart disease, but there was also not a lot of processed foods. Today, we have more processed foods, more toxins in our food, more trans fats, more salts, more of these additives that we never had. So what we're seeing is, as we process our food more, heart disease is going up. More specifically, as we use pesticides and herbicides and other additives, massive correlation to heart disease as we use more of those.
You say that our body needs cholesterol and saturated fats. How so?
Well, here's why I want to be very clear on this. We used to say cholesterol was terrible, you don't want it, let's lower it, let's get rid of it, the lower the better. Now we're finding out you actually need cholesterol for your cell membranes to work. We need hormones to communicate, send signals. You can't have insulin lower sugars unless you have cholesterol. You can't have your thyroid hormones burn fat without cholesterol. Your brain cannot perform its normal functions without cholesterol. In fact, your brain is made of 60% cholesterol. So as we lower cholesterol, we start finding that we've been causing neurodegenerative disorders, we're affecting hormones, we're causing bigger issues. And most importantly, and this is huge for a lot of us, you can't build strong bones without cholesterol. So the approach I take is we don't want to vilify cholesterol, we want to vilify the cause of heart disease, which is always inflammation, a gut leak, and toxicity.
So what do you think is the key to preventing heart disease?
Yeah, so the biggest key is understanding you don't have to necessarily worry about your exact cholesterol number. Now they're important, but don't pay attention to just the number. We want to look at your inflammatory scores, so we do need to run blood tests. We want to look at your toxicity scores. We need to check your diet, not for cholesterol and fat, but more for inflammatory foods. And some of the biggest inflammers that cause heart disease: sugar, dairy, wheat, corn, rice, and oats.
Well, if you would like to lower your cholesterol naturally or are looking for an alternative approach to your heart health, Dr. Ernst is offering a free 15-minute phone consultation to discuss your option. To schedule a free consultation with Dr. Ernst, call 704-597-7490 and choose option 3 for the scheduling coordinator, or you can visit AskDrErnst.com/consultation. Dr. Ernst, thank you very, very much, sir.
Yes, thank you.